I'm pressing it for me.
And same here. Okay, I think we are live. All right, good afternoon. It's United Medical ACO. My name is Kemal Erkan. This is our weekly Friday live session. Today we are going to discuss some of COVID-related items and updates, and as well as our behavioral health social worker, Jackie Tomasetti, will be with us for the behavioral health and the COVID-19 pandemic. She'll be joining us in the next 10-15 minutes. We also have, from our physician advocacy standpoint, insurance refund process that we want to discuss. Initially, or in the last several sessions, we kind of established the fact that this is my therapy session. So part of that therapy session is that we are going to discuss issues that physician offices are going through, why we lose sleep over certain things, and how the healthcare landscape is built in a way that, or designed in a way that it's not physician friendly, but it's insurance and hospital friendly. We are gonna discuss those with you. I have Tanner from our business development, who's extremely helpful getting up to date information for us, and then also be host this live session with me. So Tanner, go ahead and introduce yourself, please.
Thank you very much, Kemal. I appreciate that. My name is Tanner Fuchs, as Kemal mentioned, member of the business development team here with United Medical, working with the physicians on the day-to-day basis to make sure their offices are equipped with the best workflows, as well as providing daily EMR support and other system support to support their practices in the best way possible, as well as working with patient engagement as well. That's a big part of it, especially as of late. So wearing many hats.
Of course. All right. Yeah. Well, thank you so much. So I'm going to start sharing my screen from here. And then any issues, you guys can actually let me know. A couple of the people who are kind of confirming the session. So as I said, we are going to discuss the COVID-19 items, as well as behavioral health and the COVID-19 pandemic with Jackie Tomasetti, and physician advocate insurance refund process with Richa Sabesan. Richa is our director of our RCM operations. So I'm going to actually start with the live data nationwide from Worldometer that we share these numbers from. Although the total number of cases are getting lower, like when we say lower, the 72,000 2 days ago, and then 69,000 yesterday, they are low based on the really high numbers that we have, but actually they are really not low numbers. Initially, when the COVID started, when we were going over 30,000, we were freaking out, which we should still be very careful. Now, what I want people to pay attention is, although the total number of cases are low, total number of deaths are high. So 2,500 2 days ago and 2,761 yesterday. So far today was, as of 12 noon, is about 249. Now, this is nationwide numbers for you. And then from our Delaware standpoint, the numbers are, I would say, pretty similar to how it was in the last couple of weeks. It's getting lower, of course, we were expecting. So let me actually just take you to the actual site so that you can kind of see. Okay, well, Tanner, did they just move the page?
Kemal, if you go ahead, type My Healthy Community, and I believe that'll take you right to the most recent updates.
Okay, so So from our website, we were just, the link was there. I never changed that. So
Yeah, they may have moved it.
maybe
When I search,
so
oh, this looks like
let's blame the governor. So
click on, go up a little bit, and if you click on the view COVID data, you can get to it from there as well.
That's how we were getting there. So you know what, this week I was out for 3 days and then everything changes. That's what's happening. So the new hospitalization, the total number of hospitalization, we are at 197. 2 weeks ago, this number was around 290. New hospitalization as of the 17th, it was 19 total. The day before 17th, it was 43. Now we don't have yesterday's data. I'm expecting that sometime today after 2 p.m. That's usually when we get them. This is again important for percent of persons testing positive. This number is going slowly, but going down. It's 18.8%. And then percent of tests are positive. That's about 4.9%. So these are important numbers. New positive total cases, we are down to 288. This number used to go up to like 400 and even actually a couple, maybe 3 weeks ago, it was 700. So it's down to 288, which is good. So that's what we have from Delaware for you. So now, Tanner, you have some updates for us from United Medical ACO and also some vaccine updates.
Sure. Yeah, thank you, Kemal. Looking at, firstly, why we get into these updates, I think is important to remember. Just the large impact that United Medical ACO has on the state of Delaware. This data, again, we've gone over from last year, where we saw nearly 500,000 appointments amongst nearly 116,500 unique different patients in Delaware. So we really are Delaware when it comes to the amount of patients and care that we're providing for our community. So we like to make sure that we provide these updates for our patients on the data that we're keeping track that is COVID related. So stuff that we have gone over before is some of our key metrics that we keep track of are patients that are testing positive. We see a little bit of a climb here after that steep peak that we had hit right around the holiday season, coming into the new year. Now, the most recent number, we're getting back towards the 30%, is of course concerning. We do just want to take it with a little air of caution, considering that you can see down below our number of orders that this data does reflect are dropping a little bit. So just as a reminder, these are the orders that our physicians are placing within our EMR. So the orders that if you maybe get a test done at a state center, at a pharmacy, if it's not initiated by your PCP, we're not going to capture that. So we just want to remind everyone to make sure we're keeping an open line of communication. If you are getting tested, make sure you're communicating that regularly with your PCP, with your provider. That way we can make sure it's accurately documented and we can really get a good grasp and clarity on this data that we are presenting, and that we're making sure that it's all very transparent. So another thing that we do with the business development team alongside with our practices is we keep track of these test orders, and we make sure that we can get a hold of these patients, see if they've been able to get tested. If not, maybe what might be keeping them from getting tested. And then we also then are coming back and closing that loop of documentation, making sure that we do have that test result documented in our patient's electronic record. So our red line here represents our positives, and our two other lines are yellow and are blue. Our patients that have the test ordered but are unable to get it completed or are just choosing not to get it completed. So that could be for a number of different reasons, but we want to continue to make sure everyone is getting tested as much as possible. When you have that order, go get tested. Just because we have things such as the rollout of the vaccine, our numbers are trending down and it's promising, but we do want to make sure we're keeping these numbers accurate and up to date. So we would encourage everyone to please continue to get tested. Go to your either your primary care and get that test ordered, or if you are getting a test done elsewhere, make sure you're communicating that back to your PCP. That's going to be very important.
So thank you, Tanner. So I think because we are repeating some of these every week, and it's important to repeat them because we do have different people watching these events. So as well as we are providing the data from Delaware or nationwide numbers, we are also giving the data from United Medical ACO, which is our main focus. So the numbers that Tanner was sharing, they are important because we actually actively follow up on those patients. We were doing that for the testing process, but now we are actually doing the same thing for the vaccination, which is challenging. So I'm not going to actually just sugarcoat that. It's extremely challenging that getting the vaccine. Unfortunately, in the beginning, it was almost like people were not going to get the vaccine, but now everyone wants to get the vaccine. But for primary care offices, for outpatient practices, getting that vaccine is challenging. So we do not get them. So we have to do a lot of work to get to that point. So when we are sharing these numbers, I don't want you to take them and just see that, well, why are they sharing the same stuff every day? They are actually progress data. It's not the same, but it's the base of the data is same, but the values are different. But just for people to know how difficult this process is, it's important for everyone to understand that. Now, we are going to give you the update on the vaccine and what's happening with the vaccine, and then Tanner prepared a couple of slides for us. So I'm going to let him just go through those.
Sure. Thank you, Kemal. Appreciate that as well. And now this data, as Kemal did mention, is information that I'd been looking into, researching and gathering. And some of this is some updates that we have previously given. So this first, we just kind of want to get started on something we discuss often are the vaccines that we have currently or that we see are being administered. But kind of wanted to really give this as a full picture focus on the vaccine process, not just here in the United States, but this is around the world, just how much work is being put into these vaccines and how many different candidates are really out there. We hear a lot about the Pfizer, the Moderna, the Johnson & Johnson and AstraZeneca ones, as they are, of course, the furthest along in this process. But there is a very tried, true, and regimented process for scientific research, clinical research, and data that's collected, and that these aren't just being pushed through or some randomly popping up vaccines. So there is a lot of time, effort, and data that goes into these vaccines for across the board. And they are being brought to us at record paces that I was mentioning. But that is not to sacrifice any of the clinical scientific research that's going into these. And we're seeing now with what we see here is some of the information that we now know, of course, about the vaccines that have been authorized for emergency use, which is the Pfizer and the Moderna, which we know. And the next in line seems to be the Johnson & Johnson. So last we had shared that they had applied for emergency use, hoping to get some more information on that by the end of the month is where they are aiming to have that process completed. We do know that the Johnson & Johnson is a one-shot 66% effective in preventing symptomatic disease, along with some other similarities here in our side effect profile that we keep track of, as well as the storage and shipment. So this is going to be a good one. Logistically, being a one-shot vaccine, we're very hopeful that with the emergency use authorization of that vaccine and production, that will help relieve a lot of the logistical issues we do have with that. Something that I really quickly just wanted to mention with those vaccines that we do already have being administered, our Pfizer and Moderna vaccines. Now, for our patients that may have already gotten a dose of the vaccine, they may know that they've received the Be Safe packet to kind of keep track of symptoms and side effects that you may be experiencing. And it's a regular update, so you'll get a text message. It asks you just to report on your side effects, what you might be feeling for that day, and it regularly keeps tracks of you and how you're feeling, which is very interesting because it's all real-time data that we're collecting. And now we're starting to see some of those reports come out for the first month of vaccine. So within that first month, from December 14th to about January 14th, 15th, there was a little over 13 million that were administered, or at least that they had data from through the VSafe program. And overwhelmingly, all the data came back showing that the side effects were, of course, very mild, if any, that were coming for these first shot vaccines, with the leading symptom being a headache, fever, chills, those types of symptoms that we saw. And I believe the number was 41 or 42 cases of severe allergic reactions amongst that 13 million. So that was very good data coming out of the initial VSafe study that they are doing. The other update that I came across was we mentioned in the side effect profile that these COVID vaccines were studied clinically in a specific age group from ages 16 to 65 or 16 to 65 and older. So one group that had not really been studied or was excluded from the initial trials was pregnant women. So this just came out this morning. There's news that Pfizer is going to begin their vaccine clinical trial in pregnant women. So this is going to take place across, not just here in the United States, but there are participants from across the world, which is going to be vital to collecting accurate data and making sure that we have safe, clear data and science on this group. So that's going to be interesting to watch going forward. As with anything, though, we recommend to talk to your primary care doctor about the vaccine if you're having any hesitancies. If you want to find more information, there's plenty of information out there. We encourage you to go and look for that.
So, Tanner, there's one last slide there. I'm going to actually just read that directly. So the total number of vaccines administered is 57.7 million. So it's almost 58 million. The ones that's already delivered to the facilities is about a little over 73 million. So there's about 16 million not being utilized yet. And then the people who received the first dose is about 41 million. So one of the issues, the reason I want to actually just go over that with you is the issues that we are seeing as soon as now we are phase 1B, which means we are receiving vaccines from the state. And the issue that we see is patients might have received their first dose somewhere else, and then they're trying to get the second one from their PCPs. So it creates a lot of issues because the first shipment that we receive is going to be the tracking for or tracing for the next shipment. So then if we start using those for people who are not getting the first vaccine, first dose from us, it creates a lot of issues from the administration standpoint. And it's already painful that we don't have enough vaccines. And in some cases, we have people on as a backup. And then because once it's open, we want to make sure that we utilize them properly. Now, our pediatricians, I want to give them a lot of credit with the proper syringes and small and a very careful work. They can actually get more than 10, even from Moderna one, they get 11 to 12. And in some cases from the Pfizer one, they can get up to 7 doses, which is 5 normally. So that's really important because utilization and how we are actually going through with that in the offices is tough. And we want our patients to follow the instruction that they receive from their PCP. And also if they have received the first one at the DMV, they really need to go back to the same source to get that. That would be the most efficient way to help everyone else. So now we are on the 1B, and this is going to be until March, right, Tanner? So we are going to stay on that. And then as March, we are going to be from 1A, 1B, and then we are going to go to 1, but we still have time for that.
Sure. Yeah, and I think what's important with that, Kemal, just real quick, is although we are, as we saw with this phase as well, although we talk about going into the next phase, that doesn't negate the fact that anyone who is eligible now would still be eligible for that vaccine. So as we keep an eye on that, as the state does move forward here in Delaware, we just wanted to remind everyone that if they fall into these eligible populations, that doesn't, just because we're going to the next phase, of course, doesn't mean continue to reach out and to discuss that information.
All right, now we are going to bring Jackie Tomasetti, our licensed social worker from United Medical ACO. Jackie, if you are able to turn your video on. Here she is. How are you doing? You're in your office?
Good. How are you, Kamal?
Good, good. This pandemic has a lot of clinical challenges, but I think one of the biggest one is the behavioral health, the impact on the patients, the uh, what we used to already dealing with, plus with the pandemic, it's at a different level. And I know you are very busy with this process now. Just to kind of get an update from you, you were one of our first guests. And we did tell our people that we are going to bring you time to time just to give us an update. So if you can just walk us through what's going on with the behavioral health part of it, and we may have some questions later on.
Sure. So good afternoon, everybody. My name is Jackie Tomasetti. I'm the Behavioral Health Program Director here at United Medical ACO. So as Kamal said, I'm going to walk through today a little bit of what's been going on in the behavioral health program here and what's going on between behavioral health and the COVID-19 pandemic.
So Jackie, if you can bring maybe your mic a little bit closer.
Sure. Can you hear me better?
Okay, it's a little bit better.
Okay. So even though we're in a medical pandemic, we are also in a silent pandemic here in the behavioral health world. And because we're in a silent pandemic, I wanted to touch on a lot of populations. So throughout that, there are a lot of age populations, such as the pediatric population. Children are struggling throughout this virtual school. And because of that, children's needs aren't being met. There's a lot of isolation that's going on. They're not able to meet with their friends. They feel very isolated. They feel as though they're not, having their needs met. There's a lot of spikes of anxiety and depression. There's a lot more IEPs that are coming out. They feel as though they're not being, their needs aren't being met by their parents as well, because there's a lot of, differences between that as well, which I'll get into. So, children, they're talking about the behavioral differences that we're going to unfortunately see this silent pandemic in the pediatric population. Unfortunately, we may see well through the ages throughout this timeline, as well through 2030. So this is going to be a huge thing to see. Um, the next thing that we're seeing is a growing concern for our essential workers. So we're seeing a huge growing concern as well in our essential worker population with depression and anxiety, and some of them are listed there. So we're seeing a huge concern when it comes to our essential workers with depression and anxiety. And as you can see with the chart there, they're seeing a huge spike in concern due to levels of depression and anxiety, as well as the seriousness and the rate of suicide that they feel. So, as well as with COVID going up and down, the rate of their depression and anxiety is continuing to spike. So with the rate in Delaware, yes, Kamal mentioned a decline, but because of the decline, they're actually talking about that they've, for the first time, begun to feel all the trauma that they felt throughout all of the months that they were kind of on that speed. So now that they're beginning to feel, the rate of depression and anxiety is actually beginning to spike even higher. So we're really starting to watch that here in behavioral health, and we're really beginning to keep our eye on that. Something else that's been really interesting is seeing a gender disparity in this silent pandemic. We're seeing a huge disparity between women and men. Women feel extremely overwhelmed between, having household duties as well as feeling, between parenting and being working as well. So women are actually coming out feeling more depressed and more anxious than men. So that was a huge, interesting gender disparity in this silent pandemic as well. We're also seeing this throughout the younger generation, that young middle-aged generation in college as well, because a lot of them unfortunately they couldn't afford to go back to college. So you're seeing this throughout the younger generation as well, and they're seeing a huge spike in this. So here in the behavioral health world, we're keeping an eye on this as well, because unfortunately the suicide rates in this population are unfortunately spiking as well. So even though there's a medical pandemic going on, there's very much a silent pandemic going on as well within the behavioral health world that, we're definitely keeping our eye on. And, anxiety and depression is spiking throughout this pandemic, and it is serious. So I do encourage you to keep an eye on your friends, keep an eye on your family members, and have those serious conversations when you do feel like somebody is in jeopardy. So talking about the psychological effects, something else that did spike was when somebody did lose their job during COVID-19. So that is something that took a hit, and the lower socioeconomic status suffered immensely. So the people who unfortunately, lost their jobs took a huge hit, but that lower socioeconomic status is something that suffered immensely. So as job losses rose, mental health admissions rose immensely in the psychiatric system. So it's something that we're continuing to see as unemployment rises. The mental health system continues to rise as well in the outpatient world, as well as the inpatient psychiatric world as well. So, something else here in Delaware that, United Medical ACO does, team up with local organizations, and something that we also hold dear to our heart is the Food Bank of Delaware. So we just wanted to put this out there and share that, there are local food drives that are coming up. So, just please share this with your friends and families, because we all know that there are people who have food insecurity out there right now. So we just want to make sure that everybody has exactly what they need in order to, make sure that they feel secure. So, please share this with your friends and families, everybody.
So, Jackie, what I'm hearing from you is essential workers and females, they have more impact from the pandemic.
That's true. Essential workers, females, and the younger generation as well was hit very hard. As well as the geriatric population did get hit obviously extremely hard. They do feel obviously very isolated. A lot of them didn't really come out of their homes for that fear of death and dying. They were very isolated.
So I know we are supporting our population with some extra help from your side, but what else can be done if they don't have access to the PCPs, or if they are pretty much they are not able to see their physicians? Although with telemedicine, and you do telemedicine as well, right? So they should be able to reach out to us easily, right? So even like this conversation we have right now, you are in a different building. So do you see the use of the telemedicine helping with the outreach, or how are they utilizing the telemedicine?
I mean, I think telemedicine is extremely helpful, for people who don't have, computers. I think that is kind of difficult. So, even telemedicine via phone can be extremely effective. I think for people, in that lower socioeconomic status, like I was talking about, that is a really hard hit population. So I think sometimes even for them to be connected to local organizations can be really helpful for them. So sometimes even for us to team up with local organizations to get our information out to them so that they can get connected with us can be really helpful.
All right. Well, thank you so much for, number one, doing what you are doing for our patients, but number two, for coming up to this and sharing everything that you are going through with our population here. So I'm sure we'll bring you back again. Thank you.
No problem. Thanks, Kemal.
So Tanner, one of the, is Tanner coming back? So I have separation anxiety. You know that by now, right? So yesterday I was telling Anthony, he was turning his video off. I'm like, Anthony, I have to see you there. So now the remaining of the presentation we have, one of the, like, we are trying to do a couple different things in these sessions. One is, of course, sharing the new updates. The other thing is we want to use this channel as our voice and reach out to our policymakers and be an advocate of private practices. So that's one of the main things that one of our main goal is. So the item that I want to discuss is the insurance, medical insurance refund process, take back, refund, overpayment. You can actually see this in so many different ways. So when this came up to me, I actually reached out to our Director of Billing and Operations on United Medical side, Richa Sabason, and I believe, Richa, you are up. So I'm going to have her and we'll discuss this item. And Tanner, we can bring you back again so that we on the question part. So if you have any questions, we can also have you ask those questions.
Of course.
Now, Richa, it's always good to see you. How are you doing?
Hi, Kemal. Thank you. Thank you for having me. I'm well.
Thank you. And if you can just briefly introduce yourself, and then we'll start from there.
Sure. My name is Richa Sabason. As Kemal had already introduced me, I'm the Director of Billing Operations at United Medical. I've been with the company for almost 10 years. I'll be with the company in April for 10 years. So it has been a wonderful journey. I work with the RCM team here at the US office and at our Turkey office. And we manage our day-to-day, revenue cycle items for our practices.
All right, Richard. So you and I, we are going through some of the issues that we have with insurance companies, and I think one of the main issue that we look for is, where our approach is, we want to have a fair game when it's with the insurances and the private practices, physician offices. So there has to be a fair game. So it has to be kind of whatever is happening on one side should be happening on the other side as well. So I'm going to introduce this subject. Many people may not understand this, but we'll repeat this a couple of times. Now, as we use this platform as the voice of our advocacy, next week, David Benz, one of our state senators, will be with us as our guest. Last 2 weeks ago, it was Valerie Longhurst. She was the majority whip of Delaware. So she was one of those resources that we have. Brian Townsend in November, he was with us. So we want our policymakers to understand the difficulties you and I we are going every day. So let's actually utilize this PowerPoint that you put up together for us. So what I'm looking here is different insurance companies. So I'm going to actually use this. The drawing on Zoom is pretty fun. So I'm going to just do that. So I do that for the physician meetings as well. So this is our insurance companies. So these are different insurances. So we have here. So now timely filing. So Richard, what's timely filing? If you can just explain that to us.
So it is the amount of time that we as an organization have to send a claim over to the insurance after the services have been provided. Meaning, if I see somebody today, I have, for example, for Highmark Blue Cross Blue Shield, I have 12 months from today to make sure I submit that claim to that insurance.
So let's take our second biggest private insurance in the state of Delaware. It's Aetna, right?
Correct.
So if I'm understanding, I'm going to kind of play dumb. So you're saying that I have 120 days from the time of the service. Today is 2/19.
Yes.
And then from all the stuff that we are having right now, so if I don't send this claim in 4 months, then it will be, what will happen if it's Aetna?
So they will deny the claim as timely, meaning
They
that
will pay, right?
correct. They will not pay.
Like they won't pay as like they will pay zero.
They will pay zero.
So we missed out.
Yes.
So good luck. So then let's say they incorrectly deny this claim. So this is the initial one, right? So
Yeah.
this is the initial time.
Correct.
So let's assume that when we were able to send this in a timely manner. So then what happens with this corrected claim? Why is there a corrected claim limit? What do you mean by that?
Sure. So that basically means that if you receive a denial for a claim or a reason where they tell you they're not going to pay, essentially, you have a certain amount of days to go back to them with a correction. to try to get them to reconsider making a payment.
So see, the Aetna is giving me 6 months to send a corrected claim.
Yes.
So let's say if I use, I send a claim in a timely manner and they incorrectly deny. So it's important, right? So I'm going to kind of stop sharing because if my people don't see my face with too much Botox, they can see the impressions as much as clear and as effective. So here's what happens, what we are discussing here. So I have a claim for Aetna. I send this out and they say, well, oh, you don't have authorization number. Well, I do have the authorization number on the claim. So they said, well, I'm going to actually deny this. So in case we didn't act on it, it may happen with everything else is happening. So we have 6 months from that time. So let's say we got the incorrect denial from Aetna in 1 month. So 6 more months, that's 7. 7 months is it, right? So in 7 months, we are done with all the options that we have. It becomes almost impossible to get paid anymore. Now, going back here, I didn't know that I was going to lose my my stuff that I had, but it's okay. Now, this is for our initial timely, and this is for our correction. Okay. Now, then we have this take back that we actually want to discuss today, right? So what are these 24 months, the notification time frame? What are we talking about here, Richa?
Sure. So Kemal, if a claim is paid incorrectly or the insurance deems that it's paid incorrectly, they have 2 years time, as you can see for the first, 5 insurances, to recoup, however you want to call it, take that money back from you. Meaning they come on to your I guess this is a little bit more detailed. So the electronic payments that you receive, they could take them from future payments, or they can send you a letter and say, hey, you need to send me this money back, or I'm automatically going to take it back because I paid this claim incorrectly. That's what they're saying. The insurance is saying that.
So now this part is the practice, right?
Yes.
So what practice needs to do. And we are going to discuss this more because this is going to be one of our also agenda items for our policymakers. What practice has to go through is here, the limitations is here. So for example, we mentioned Aetna, but let's look at United Healthcare. So 90 days for the initial claim, and then 180 days for the corrected claim. So we are done in maximum 9 months.
Mm-hmm.
So Aetna is 4 plus 6, it's 10 months. Mm-hmm. But when it comes to getting money back from us, that's 24 months. And that actually was more than 24 months, but the insurance commissioner, their office, they were able to pass this law and limit it with 24 months. So now I have a little bit complicated part that I know we didn't actually rehearse this. So I do want to kind of talk to you, and then maybe next week when we talk to the events, we can actually bring it up with a couple different slides. So now, right now we are going through a couple takebacks, unexpected takebacks. So they have not given us the recovery notification proper time. So as we are looking at the claims, they got actually denied. They took the money from the future claims. So if you guys can go back to one of the articles that I wrote about the insurance setup, insurance structure in the United States, when we look at Aetna, for example, Aetna doesn't only sell insurance. In fact, Aetna's insured population, risk population, is only 25 to 27% in their total. So, Richard, the other 72%, 73% is the TPA, we call third-party administration, which is self-insured employers, like State of Delaware, Christiana Hospital, St. Francis Hospital, Bank of America. Newcastle County, City of Wilmington. So they are administrating those plans. So that's 75%. This is true also for Highmark, correct? So they are not necessarily just insuring people, so they don't have any risk. Now, one of the questions that that I had for these people, so you take the money from 2 years ago, you are offsetting it from the future claims, but I look at the employers, they're not same.
Mhm.
So I can't help but wonder, are they going back to those self-funded plans and then saying that, oh, we recovered money and here's your, X $1,000, or are they just becoming the benefit of, oh, we don't do business with you anymore. That was 2 years ago. It's over. So because the money is taken offset from a different employer.
Correct. Yes.
So, I mean, I'm not going to mention names, but right now we are going through this
Sure.
with 2 different insurances, and that's a problem.
It is, Kamal. It's a big problem.
Now, when I go to the insurance commissioners last week, they said that they don't actually regulate the self-funded plans. Well, who's doing it?
Right.
Like, who's responsible for this type of very heavily regulated business? And there's a huge gap. So why 2 years later? Why do I have to send the claims in 9 months latest, but they can have 24 months? So, Richa, I know there are times that we just need certain things to take our stress off. So this is one of those. So we are adding this. We need proper representation. So Tanner, if you would like, you can come up. So we need proper representation with our state committees. So private practices are going to be represented at the equal level. So it's funny that I'm the oldest one in these 3 pictures. People see. So we are not going anywhere. So we are going to make sure that this is going to happen in the next 12 to 18 months period. So the other thing is that these unfair businesses have to stop. I mean, private practices, guys, we deal with a lot of different issues. Patient is getting gallbladder at my surgery center. Medicare is paying us $2,100. They go to Christian Hospital, same surgeon, same procedure, same everything, gets $12,000. We have that on one side, right? We have this from the insurance side. We have, even the state doesn't care about us, so we don't have a proper representation. We are so lucky in the state of Delaware with a total of 4 ACOs representing the vast majority of the population, and we are not taking advantage of that. Look at the vaccine rollout. It's a disaster. I mean, sometimes we are kind of embarrassed when we are putting the word disaster on the PowerPoint, but it is. But how can you actually describe the disaster in a different way? Challenge, right? So we say, to be nice, if we have a host, we say challenge. If you don't have a host, we say disaster. It's a disaster. So disaster in a big way, because like in a really bad way. So they have to really stop and then understand what we are doing, what struggle. And I'm so glad in a way this pandemic we are going through, because we wouldn't be doing this.
Right.
We wouldn't be able to talk. We wouldn't be able to take advantage of this. So maybe, again, like every time we are going to find some silver lining. So this is our silver lining from this. So this has to stop. Now, Tanner, sometimes I surprise you with some of these topics that we didn't discuss. So this was one of the new ones. But I don't know if you have any questions. So Rich and I, we can answer if you do.
I think it's very important as we do continue the physician advocacy arm of our outreach. As we've talked about numerous times with our triple aim, I think making sure that our patients and the patient population is aware of these types of issues really ties back into improving quality of care while trying to reduce costs from our side of things. So I think it's good, because hearing it from us is going to be important. Not only that it's coming from the ACO, but it's good to remind everyone that this is really advocacy for patients on the primary care level, that we're not just talking about ourselves or what we're doing here, but this is really good for anyone and everyone who is seeing a primary care doctor across the state who is might otherwise not be aware of what's going on. So as we take on these kinds of conversations and we do get our local representatives involved, I think it's very important that everyone understands and has a good grasp of these issues that we're
do better,
facing.
right? So the quality, in order for us to do the quality better, we have to be free from these types of issues. That's what I'm hearing from you.
Yes. Yeah. So
Kemal, I would just add that, this is important for patients because we receive takebacks sometimes for things such as services not covered. That affects the patient because after 2 years, if you're coming back to me and telling me that something I took care of for a patient as a provider is not covered, that bill may end up in the patient's hand, right? So it's very important to understand that it does not just affect business, it actually affects the lives and the livelihoods of patients who have out-of-pocket expenses for their insurances. And this could be a huge surprise. If you had something that was done 2 years ago, and as a provider, I'm not able to appeal it because your insurance company didn't recognize that they paid something incorrectly, you're going to get stuck with that bill, which is a huge burden.
Richard, that's really important. So when we are unwinding this, if we can put a couple slides together to explain the work flow that we have to follow, because there are takebacks which may not need any follow-up. But there are takebacks where we actually were, let's say the insurance is saying that they were not the correct payer. And then 23 months later, they are telling us, now I have to send that to the correct payer. 23 months later. And then we are going to get denials. We are going to send the appeals. So if we can actually just put that together, and it's also good for some of our employees to actually understand that process as well, because some of our providers to know that, because some knows, but not everyone. So I think that would be extremely important. So next week, maybe we can just open this up a little bit more. And also, I know how much stress this brings us to the practices when it's not followed through the proper notification time. Then you are surprised with the big numbers. So, and maybe if we are not able to solve these problems, maybe we'll mention the insurance companies that we are dealing with, how much they took back one specific insurance and there's no notification. So we are going to actually utilize our channels and make sure that someone is going to hear us at some point. So I'm actually extremely happy that we have this platform now. Speaking of the platform, we do have our now set events. So I do want to kind of quickly show those from the United Medical ACO side. This is from the YouTube channel. They can actually see pretty much everything in a nicely designed playlist. Now, actually, I don't know if you guys saw what Amy did, this quick tips with Amy. I actually didn't know this the way that they did it, so it was a surprise to me too. So I enjoyed that video a lot. So I think they're going to do more. From our bariatrics program side, my live events with Dr. Erkan is still happening, and it will be like our set Wednesday. And then this Tuesday, Dr. Rose Singh will be with us. And on Wednesday, 7 p.m., we have Amy treating low blood sugar and exercise safety. That's on fourth Wednesday of this month, which is next week. Now, guys, we have Dave Benz, as I mentioned, he's confirmed. I just got a text message earlier. So while we are talking to him, two of the issues, again, the representation and the payment-related, take-back-related stuff that we can actually bring that up to his attention, and let's see where the process is going to take us. So again, thank you, everyone, to be part of this. Richa, I know this was kind of like a last minute as usual, but it's your topic anyway, so you knew everything. So thank you for joining, and Tanner, thank you for everything you do. We'll see you guys next week. Thanks. Bye-bye.
Thank you, Kemal.